So here with Darren Perry. Darren and I have a visual relationship that goes back over about 13 years now, Darren, is what I figured. Darren and I first came together back in 1998 when you had your Lasik laser vision correction, and then you were playing for the Steelers as a defensive back, right?
Yes.
And you told me 9 years with the Steelers. And can you remember back to why you chose Beach Eye Care 12, 13 years ago?
Well, one, I wanted to first and foremost improve my play on the field. I was wearing glasses, uncomfortable when you're out there playing football and you got to worry about contacts popping in and out, and so I was looking for a way to improve my performance on the field. Had some people that had had the laser correction done and wasn't sure if I wanted to go that route. When someone is dealing with your eyes, that can be an uncomfortable feeling.
Certainly.
And
you want to do your homework.
Yeah, exactly. I was a little
so
uneasy if I wanted to go through that process, just for fear of something potentially going wrong, this and that. And but after doing some homework, talking with some people in the area, they referred me to Beach Eye Care, and I tell you what, the procedure was virtually painless. And relatively quick, really, and saw instant results, helped me on the football field, and I'm forever indebted to you from that respect, because it did help prolong my career, and I was very pleased with the results.
Right. Well, we like you to see what you're doing. And as I recall, Darren, I think your vision, back in '98 was like 2200. Without your glasses or contacts, which means what somebody could see from 200 feet away, you had to get 20 feet from it.
Yes.
Okay. And there's some quarterbacks with some arms in the league, so that ball's coming fast.
Yes, it is.
There's some receivers that can have some fast moves there as well that you got to keep up with.
Yeah, you do. You do. And
you're watching two things at once, right? As a defensive back there.
Yes. Yes. And from my position on the field, I was at a good distance away from my primary read, which was a quarterback. And so any vision that I could pick up on him that much clearer would only help my ability on the football field, and then not to mention tracking the football once it's in the air and being able to pick it up and locate it that much quicker. And then you factor in night games and so forth. It was a little bit uneasy, and you didn't have that confidence. And so from that standpoint, having the surgery really helped me in that area, not only on the field, but it just helped me just in my normal day-to-day living.
Right. We all like to see. We like to see the details and enjoy, and it is an incredible thing every waking moment that we've got our eyes open. Because I was a year ahead of you with my own laser vision correction in '97, and a little more nearsighted than you were. So.
Yes.
Now, as I recall, Darren, I think you told me that you even played some games with no contact lenses with that vision, and really had to use your instinct then. So.
I mean, and to this day,
squint.
Yes, and it wasn't until our equipment manager in Pittsburgh came to me and said, "You may want to look at getting some contacts." He said, "because you squint all the time." And he's been around for years, and he said he had the same issue with John Stallworth, the Hall of Fame receiver for Pittsburgh. He said, I noticed it with John Stallworth, and I'm telling you, you need glasses. I don't know. He said, I don't even know how you intercept as many balls as you do, because you need glasses. And he was adamant about it. And a couple years later, I said, you know what? I'm going to look into doing that. And found some people, investigated some doctors out there that were performing the surgery, and found Beach Eye Care to be the best place for me to go.
Had laser vision correction. It just gives patients a lot of confidence that the doctor's been a patient. He knows what it's like from both sides.
Yes, so. and the thing whenever you start dealing with your senses, in particular your eyes, the natural reaction when you get close is to close them and blink. And so sometimes human nature kicks in, and you worry about some of the mishaps and what could potentially go wrong and so forth. And so finding someone that you felt really comfortable and confident in was just tremendous. And even coming back and getting a follow-up procedure with you, the Green Bay Packers, a great organization, they have some doctors that they recommended. And after talking with them, I wasn't as comfortable and as confident with those guys, and I said, you know what, I'm going back to my doctor that I know is going to get the job done, and here I am. I tease my players even now that now having this surgery, I won't miss a thing out there. So
that's right.
When
you
you're not doing
details,
and the steps, you know, that might not be in line with the technique that we're asking you to perform, we'll be able to pick it up, and it helps me more so now, probably just as much as it did when I was playing, because we watch so much video and we're always looking for tips and tendencies in terms of a guy's stance. Is his weight leaning forward, backwards, which hand,
so
weight pressure. Yeah, exactly. Just so we can
what he's going to do right from the start.
Yeah, and so being able to pick those things up from constant video study helps, and being able to have the eyes to do it, you know, is a tremendous, you know, benefit.
Right. So, you know, Darren's vision had kind of changed from '98 to 2010. Over those 12 years, his 2020 distance went to be in between 2025 and 2030. Now, a lot of people say that's good. I see fine. I don't need anything further. But with what Darren does, having to be able to read the numbers of the players and read all their body language, you know, there with helping his defensive backs as a defensive back coach you needed sharper vision than that. So that's why you said in the off season we need to dial it up a notch.
Yes, and even picking up personnel when you're watching video. Is that number 44 that's in the slot position, or is that who's that playing tight end? Is that number 87 or 88? You know, so those little things, they only help in preparation, you know, putting together a scouting report, and you realize that your eyes are so key, because we always tell our players that, you know, you have to believe and trust in what you see, and it all starts there, because if you don't believe in what you see, it doesn't matter how much we instill in you, you're still not going to perform at the level that you need to.
Right, you've got to log it into that data bank on these players' tendencies, and then you see all the detail and fine detail there. So Darren, when we did your original procedure, we could just treat numbers, meaning your prescription. When we did your enhancement earlier this year, we used what's called a wavefront guided or custom treatment that let us adjust and treat distortions in your vision, things that can give like halos off the lights or the starburst effect, you know, off of lights. And I personally have had that kind of same laser vision correction when I had a fine-tuning of my vision in 2007, 10 years after my original procedure there, and went to 2015 like you are today, and seeing 2015. It is incredible to see the detail, whether you're enjoying our area, seeing across the water, you know, seeing the you know, the birds flying and all those details. But I can remember one of the things for me about 3 months out, I had a surface laser vision correction, so it takes longer to recover than a LASIK procedure does there. And that was just related to my cornea being too thin for any further LASIK. So it took about 3 months, but I remember hearing a helicopter flying, and then I could see it, you know, picking it up even a mile plus away, watching the blades turn, seeing those kind of details.
Just tremendous. I mean, and jumping here to another subject, even, you know, when I'm out playing golf now, I mean, just in terms of your depth perception and picking up the flag, is that flag's 120 yards or 100 yards? I mean, those little things. And now, having said that, if I don't get down in the 70s this summer, Doc, I'm gonna be a little.
You'll be back and talking to me.
I'll be talking back with you.
We'll need to get you some golf lessons.
He said you can help on the vision. You can do anything about the swing.
That's right. No, exactly. And I certainly am not a golfer, so I'd help you on the tennis court. I think you've got a daughter that's a great tennis player. Right? We go upstairs to the laser suite and take a look at some of the equipment that we have today. Some of the equipment that we used for you. But that will kind of give you know, our folks who are getting a chance to join us in conversation to look and understand today's technologies that make this even safer and better. Because as you mentioned, fear was one of those big things that held you back for a while till you got to a certain confidence level, trust in your doctor, and the team taking care of you. This is a team approach, just like you have a team approach.
Absolutely.
And what you do, we do the same at Beach Eye Care and taking care of our patients.
It's like putting together a game plan. The guys got to feel comfortable and they have to believe in it in order to execute.
That's absolutely right.
Coming back here and just seeing all the growth in technology, I mean, was truly amazing to me, and just the test that we did, you know, pre-enhancement, I mean, really just gave you a sense of comfort. And just further, you know, etched in my mind that, hey, this guy knows what he's doing, and really gave me a sense of comfortability.
Thank you, Darren. Appreciate that. Let's head upstairs to the laser suite. All right, Darren. Well, we've come upstairs now just to take a look at today's equipment in 2010, and this is the newest Intralaser, which is an infrared laser to create the protective flap.
Okay.
In our days of LASIK laser vision correction, it was a mechanical device and a blade. So that's really when the surgeon experience and knowing that equipment was really key. It's even safer now because we have the computer precision of an infrared laser to create the protective flap. Now, in this room, starting in 2002, was the first Intralaser in all of Virginia, the 24th in the whole country. This is a 5th generation one, okay? And the speeds of it, those speeds went up. It started at about 7,500 pulses a second. Now it's 150,000 pulses a second.
Wow.
So it used to take 80 seconds to create a flap.
Okay.
Now it takes under 14 seconds.
Oh, man.
But it's not always about speed. As you know, on the field, you've got to make all those right decisions and judgments of how to do things you know, there. So this just gives us incredible consistency and precision in that step of creating the protective flap. So that's what gives us that access to correct our vision.
Okay, okay.
So then the other big improvement that came in late 2008, and the newest of excimer lasers that correct our vision, is the IQ laser. And the IQ laser wave light Allegretto gives us the ability to do wavefront guided treatments like you had. So being able to give it that sharper vision if you've got more distortions than normal, as well as wavefront optimized treatments that are real accurate, especially for farsightedness, astigmatism, but of course nearsightedness as well.
Does it speed up the process, Dr. Neatrour?
Actually, it does. It's pretty cool, Darren. This chair comes right up underneath. They'll have the Intralaser part created, right eye, left eye. Then it goes back out, rotates over, comes back underneath here.
Okay.
And what you'll like, that you're used to being under the stadium lights, this has some little Heaney lights. They're like stadium lights, 4 of them, that shine onto the eye.
Okay, okay.
And then it's about a 2 to 3 second process per diopter of nearsightedness.
Okay.
So say, for example, somebody was 2 diopters of nearsighted correction, 400 pulses a second, 6 seconds and their laser vision correction's done.
Completely done.
Yes. But again, it's not all about speed, it's about accuracy associated with it. The cornea dries out more, that can put another variable that would get more or less response if there's moisture there. So it's just these technologies that let us borrow from that sports phrase that a lot of us like to say, one and done.
Yeah,
do it right the first time, put you right where you want to be, don't have to come back for fine tuning until 10 years later, because admit it, Darren, we have to face it. We're still human. Okay? And we just some of the things I wanted to share with you and you folks that get a chance to take a look at the video that we have here and share our experience. So.
Okay, great, great.
Darren, pleasure and honor to take care of you. We'll look forward to another good football season there. See if the Packers can top that, right?
Yeah, absolutely, absolutely. We're shooting for Dallas this year. That's where the Super Bowl will be in 2010, and we plan on being there. Thank you so much, Dr. Neatrour. I tell you what, it's been a pleasure working with you, and you've just helped enhance my career that much further along, and I'm very thankful for that.
Excellent.